So TMS stands for transcranial magnetic stimulation. I consider it the creme de la creme of psychiatry, and I think a lot of neurological things are in the works as well, as far as stroke recovery and Parkinson's and dementia and a whole host of things. We're really using energy to activate underactive brain pathways that cause depression.
Hi, this is Ken Renner, the host of the Rita Health and Wellness Expo, and I'm here with Dr. Benning, and she's with Texas Hill Country TMS. And she is a credible technology that's been expanding all over Central Texas about helping. She's a doctor, psychiatrist, and helps people with clinical depression get out of it with a proven treatment, proven protocol that's right now exploding. It's taking everything by storm right now. So, when I asked you where's your practice, you said, well, we have 8 practices. So tell me about where your practices are.
Yes, we've got 9 locations now.
9, okay.
So all over the Hill Country, plus one that's technically not in the Hill Country. But we've got Burnett, Killeen, Dripping Springs, Fredericksburg, Canyon Lake, Marble Falls, Lampasas, Lufkin, which is not the Hill Country, and then Liberty Hill is one of the most recent ones too.
Great, and it's just down the street on 29.
Yeah.
So that's great. So tell me what this is all about and the results that you've been getting for your patients.
Yeah, so TMS stands for transcranial magnetic stimulation. I consider it the creme de la creme of psychiatry, and I think a lot of neurological things are in the works as well, as far as stroke recovery and Parkinson's and dementia and a whole host of things. But we're really using energy to activate underactive brain pathways that cause depression. And then we can use a different form of energy to inhibit overactive pathways that can cause anxiety, PTSD, obsessive compulsive disorder, etc. So it's really using energy in the form of hertz to target specific areas in the brain to remedy a lot of these mental health diagnoses that we're seeing.
And you're seeing, before we got on the podcast, you had also said that you had 80% results, or as regular medication is, we talked about 20% get pretty good results from regular medication, but the other 80% are not quite, it's just a little of a Band-Aid. So tell me about that.
Yeah, so in my experience, because I used to do medication management and therapy like most psychiatrists do, and I've been doing TMS for the past 6 years. When I did medications and therapy, sometimes medications worked really well. They took care, they solved the problem. People did not have side effects, and they were a game changer and a life changer. And so I'm not anti-medication whatsoever. Unfortunately, I felt like most of the time it did not. It was either partial improvement in symptoms, often a lot of side effects like numbing or sexual side effects or feeling tired and things that come along with the medications. And they just weren't helping that much. So I was pretty dissatisfied with the tools that I had at the time to really help people.
So how did you find this technology?
I started working for a bigger company in Austin doing TMS during COVID, actually.
Okay.
And it can help with long haul COVID symptoms too. But I started working for a big company around that time, and I was blown away by the results. And TMS is in a lot of big cities. It's in Dallas, it's in Houston, it's in San Antonio, it's in Austin. But I live out in the Hill Country, and this is something that people need to come to multiple days a week. It's really quick sessions, and people drive there and drive home. But they need accessibility to the actual clinic. And so my whole premise was, let me put it in small towns where people can actually get to it and improve access.
Well, that's great, because if you have to drive too far, you're not going to do it.
Yeah.
Especially if you're depressed.
Right. Exactly.
So you said it treats other things, but depression obviously is the main one, because that's a big problem. And well, before we get into that, we talked about. I looked it up. I researched. It's about between 1 in 10 and 2 in 10 people are of somewhat level of depression, and so that means if you're in a room of 100 people, 10 people are suffering from that. And so, I have my own personal story with I told you, my father, who for the last 25 years of his life, he dealt with depression. And it's so tough on the family. It's so tough on the person that has it. And they really don't know what to do. And so to offer a solution that works, that's amazing, because, tell me a little bit more about not only depression, but the other things that it treats.
Yeah, so we get it covered by insurance for the most part for treatment-resistant depression, meaning if people have tried 2 antidepressants, insurance covers it. Now, it also is FDA approved for obsessive compulsive disorder.
Okay.
And we can get insurance coverage for that as well.
Wow.
And then it helps with PTSD.
Ooh, okay.
It helps with generalized anxiety disorder. It helps with even like bipolar depression. Now, insurance won't yet approve it if somebody has bipolar, but a lot of times people with bipolar really struggle mostly with the depressive episodes, not the mania, right? And so we're able to treat the depression with essentially the same protocol that we're using for treatment-resistant depression. So those are the biggest things that we are seeing in clinic.
But you got ADD, ADHD in there too, right?
ADHD, yes, it helps because we're stimulating prefrontal cortex. So we place this coil up against the scalp on the left side. It's activating underactive pathways, but it's also just stimulating directly the prefrontal cortex. So things like focus and concentration, thought clarity, like brain fog usually goes away within a week or two. Word recall is a big one. So some people that have some, cognitive symptoms will see improvements in word recall. That's a really big one. And also judgment, forethought. People are able to think before reacting. So a lot less reactivity, a lot less irritability. Things that used to bother people are kind of rolling off their back now. They're less bothered by things. And that's a lot of prefrontal cortex activity.
So what are your typical ages for your patients?
So now we can treat 15 and older. So it's FDA approved for adolescent depression, meaning 15, to 18. And it's had the approval with the adults 18 and over since 2008.
Okay. So it's been around for a while. It's not a new technology.
No, I don't know why it's not more
That's
prevalent
the
and
first
talked
time
about.
in fact, I looked it up and I'm like going, what is this? And then, wow, this sounds pretty interesting. And, and it medically, insurance approved. So it's got to have some legitimacy there. So it was like, this is very interesting. I want to hear it. Personally, I have my own personal experience with that horrible condition. And so it must really light you up that you're able to watch people get healed.
Yes, it is the most transformative thing I have done. And I've worked in a lot of the drug and alcohol rehabs too. I love that population. Rehab and TMS are kind of my two niches that I really am passionate about because we see so much transformation.
So do you work a lot of times with people getting out of jail or that's kind of PTSD too, or military, because you have a place in Killeen.
Right. See a lot of the veterans and spouses of veterans and family members. Yep.
Yeah, because they leave for 3 years and then their spouse is at home and they get depressed. So, well, it is an epidemic, and I don't think there's not enough news about it because it is so serious. I think I looked it up too. It's the number 2 cause of death for youth. Behind accidents. So what you're doing is like, it's not just a game changer, but it's like a movement. And so, innovative, bringing it to small town. I mean, I wish other doctors would do that. I mean, that's because, especially if it's working. So hats off to you. So where's your location going to be here in Liberty Hill?
We are in the Office Park, Highway 29 Office Park. So right in kind of central old Liberty Hill, that side of, of 183. And we're open 9 to 5. We have a lot of flexibility with appointments. That's the other thing. And we get people in quickly. We get insurance coverage usually once I'm the psychiatrist. I've got to see all the patients. Me or Dr. Casey are the 2 local psychiatrists here. So we have to clear a person initially, and we do that via a Zoom consultation. And then we submit, if their insurance requires a prior authorization, we'll submit it that day. We usually get approval within 1 to 4 days, and then they're usually starting treatment within a week from being seen.
So long haul COVID, tell me about that, because my wife is suffering from it. And how does it, she's 3 years and 4 years into, still has symptoms and still doesn't taste as well. And so it was really kind of she got the worst of it.
Yep.
So.
And we've had people, it brought back their olfactory, they can smell again. One person regained her whole sense of smell doing TMS, which is amazing. But because the virus can damage, any insult to the brain, there's many, right? There's substances, there's viruses, there's mold, there's other toxins, right? That can enter our system and affect our cells. And our cells run on electricity. And so when they lose that electrical activity, they can't communicate with each other. It's not working, right? And so with this non-invasive brain stimulation, it's like we are reactivating brain cells. That's amazing. That's where we're seeing improvements in a lot of these insults.
So she not only had long haul COVID, she had 2 concussions. Would something like this help her concussion experience? Because she has memory loss at sundown syndrome.
Yep.
And so would that help too?
Yes, TMS is one, and I always encourage people to do their research and look it up, because people are going to be blown away like, oh my gosh, what is this? It's legit and it's really good. But post-concussive syndrome, TMS, is one of the only things they're finding to actually help with post-concussive syndrome.
Right. So being close by and be able to help my wife with the concussions, because they were going to take 6 weeks to even see her, the neurologist. And then there was no guarantees, and they were probably just going to put her on some meds.
Right.
Well, she has level 10 headaches and can't walk. She walks
Yes.
the walls.
And headaches, people who have chronic headaches, usually TMS gets rid of them.
Oh, that's amazing.
I mean, and people with fibromyalgia and depression, every single person we've had that has had both, it's gotten better. So there's a lot of just interconnectedness, you know, within these pathways of lots of different
That's great.
ailments that people have. Yeah.
Well, so put your hat on and let's tell you, who's your perfect client right now? Who's your perfect patient?
My hat says, ask me about TMS. Who's our perfect patient? Somebody struggling with depression and or anxiety and or PTSD, who has tried and failed a couple of medications, or who doesn't want to go the medication route. We might not be able to get insurance coverage for that, but we've got affordable prices on self-pay if we need to do that. But someone that really has tried and failed other methods to treat their depression and their anxiety and are looking for something that has usually no side effects, maybe a mild headache, rare, but usually no side effects, and that they can access easily and get covered, you know, again, for the most part by their insurance. But this is something that it's non-invasive. People drive there, they drive home. You know, insurance covers 36 sessions. People come 3 to 5 days a week and knock out those 36 sessions. And the initial, you know, appointment is the longest. It might be 20 minutes. And then after that, people are in and out in about 5 minutes. No activity restrictions. You can go do whatever you need to.
And they're allowed to continue on their meds if they want to.
Yes.
Right?
And if they're on medication that's partially effective, they can keep taking it. If they're not on medication, they tried it in the past, that's fine. They can be on or off medication. There's very few contraindications for TMS. The only people that can't do it are people who have seizure disorders, like active seizure disorders, or metal in their scalp near the area that we would stimulate.
Okay. All right. Sounds really good. Well, this is Ken again, and Dr. Benny, you're going to be here? Okay. Amazing. So Dr. Benny, thank you for being a gold sponsor of our event. And she's going to be here, and you can talk to her, you know, personally, and hey, make an appointment. And that's going to be on June 13th, Saturday, June 13th at Santa Rita Ranch Health and Wellness Expo here in the Ranch House on Elizabeth Park Boulevard here in Santa Rita Ranch. So we'll see you on June 13th from 10 to 1. Meet Dr. Benning and get healed.